you want to be able to create a diabetes management program. But what this does is you're going to be able to detail the information on how your skilled nursing company, your physical therapy company, your occupational therapy area, and your home health aides can help assist in the patient with diabetes. And also at the same time as talk about how each individual patient is going to be cared for, depending on what type of diagnosis that they have, whether they have diabetes type 1 or type 2, or if they have any additional symptoms in addition to the diabetic problems, such as diabetic retinopathy, changes in vision, or you can talk about if they have diabetes with polyneuropathy, or where there's decrease in funny sensation or weaknesses, right? You want to be able to talk about information in diabetes and also be able to explain on what your agency can do, your skilled nurses can do, what they can do about completing the physical and history assessments, looking at the disease process and teaching if the patient has any wounds, how they can provide treatment for the wounds, as well as provide educational tools for the patient and for the caregivers. Remember, we're not going to be there 24/7. We're going to be there every now and then to be able to be a supply, somebody that's there to provide additional services and contact. But ultimately, we need to be able to teach the patient what they need to do to care for themselves, or to teach the family members, the caregivers, or the loved ones what they need to do to help out with taking care of the patients. You want to be able to make sure you provide medication review and teaching. Talk about the blood sugar monitoring and teaching. If the patient is able to actually have a telehealth program added, maybe we can add a telehealth program so we can monitor the blood sugars more seriously, especially for brittle patients. You want to be able to have skin assessments and skincare educations. One of the biggest problems that patients are facing in diabetes is the problem that they affect is they may get wounds. And by us providing skin assessment and skincare education, we can prevent the possibility of them obtaining wounds that may cause problems in the near future. We want to be able to provide education, insulin injection, and documentation and compliance to make sure they know what they are doing. Your therapy, your physical therapy can provide full therapy assessments. They can provide neurological testing and home safety evaluations. They can provide equipment evaluations on how to be able to use equipment properly. They can provide assessments and how to strengthen range of motion and ambulation and balance assessments. They can provide patient caregiver education, what they can do to better themselves. Your occupational therapy, they can complete OT assessments, work modifications. They can provide ADL retraining. They can provide visual acuity assessments and retraining. These are things that your company, your team can provide and should provide. And by you being able to detail this out, to be able to tell that story on what your company can do for the patients of these physicians, these referral sources, it is very important for you to do that. And at the same time is you not just knowing it, your referral sources not just knowing, but every one of your staff should be aware and should know what it is about, what your programs are about, what your diabetes programs are about. That you need to make sure that you guys attack the problems that's existing. Remember, diabetes is a serious and chronic disease that occurs when the body does not have the ability to be able to produce insulin or enough insulin to be able to metabolize glucose. This is something that you need to be able to explain to the patient, to the family member. You need to educate them. There is no known cure for this disease right now, but research continues on how to make progress. Now remember, according to the American Diabetic Association, diabetes affects 25.8 million children and adults in the United States. For people over the age of 65 years of age, there are 10.9 million of them, or 26.9% have been diagnosed with the disease. Early diagnosis is important, so appropriate diabetic care and management can be initiated. Some complication may arise, which includes heart disease and stroke. You have high blood pressure, blindness, kidney disease, nervous system disease, and amputation. In order to reduce the complications, we want to be able to make sure that we manage the disease properly, that it's essential for us to manage the disease in order to be able to help the physicians with managing the disease. So we have to make sure we bring in any modern day approaches to diabetes, and at the same time is talk about any dietary or lifetime management that we can do. Are you aware that you can actually have a dietitian visit a patient that it is actually covered under Medicare? Talk about how you can send a dietitian to the patient's home. So make sure you have contacts with dietitians out there so that they can actually evaluate the patient, evaluate the diet, give some suggestions and advices for that patient. Your job as a company is to be able to provide a lot of information so that you can show that you have knowledge, so that you can show that you are the right person for them to start referring patients to you. Remember, create diabetes management programs, market it, show it, make sure you know about it, and to guarantee that, and if you do this, I guarantee you're going to get more referrals. Because if you are better at selling, if you can actually describe these services rather than somebody else coming in and telling the doctor says we have a diabetes program, whereas you walk in and you can create a 15-second, 30-second elevator pitch about the diabetes program, especially if you know that that physician has a large demographic of diabetic clients, right? That's going to be able to increase the chance of you getting more patients, you getting more referrals. Look, it's the one that looks educated, that is educated, that can actually provide more services that's going to win in this company, that's going to win in this industry. So you need to be one of those, and a diabetic program is something that's definitely something that you need to add to your program now.